Welcome back to Small Changes, Big Shifts. I'm Dr. Michelle Robin here with Bailey Sosa. And you know what? I love to collect and connect with people. And my friend Dr. Marion introduced me to Dr. Tyler Sif. And the minute she walked in the room, I knew I wanted to be her friend because she is a bright light that just exudes not only confidence, but really kindness and curiosity. So I invited her to be on the show with us today. So, Dr. Tyler, welcome to Small Changes, Big Shifts.
Thank you so much for having me today. I appreciate it.
Tell our listeners a little bit about your story.
So a little bit about my story. I always like to center any story that I start with in terms of talking about my identities. So professionally, I identify as a general academic pediatrician, a fellowship program director for academic general pediatrics, an associate professor for pediatrics, and also associate dean of inclusive excellence in the Office of the Learning Environment. I also identify as a mentor and a sponsor, a coach, but then personally I identify as a Black woman, a Christian, a proud graduate of a historically Black college and university, and also a bonus mother, a fur mother, a grandmother, a godmother, a sister, an aunt, a wife, a daughter, all the different names, and also a wine enthusiast, and also one of my favorites, a bibliophile, which is for good SAT words for the kids. It is a person who loves books.
Wow, I love that. We're just coming off Mother's Day. What's it feel like to be a bonus mother?
I think being a bonus mother is the spirit of you can still be there to be an additional support for a young person. My young people aren't really young people anymore, they're full-grown adults. And also one person has actually 2 grandchildren, so I'm also a bonus grandmother, so that's also great too. And I also feel like kids can't be loved too much as a pediatrician. But I think it's also that spirit of there's more people loving into a person. Growing up as a kid, my mother always surrounded us with a village. So having a village around young people, I think is so very important. So I'm always glad to be part of any young person's village if possible.
Speaking of being a pediatrician, we have this Small Changes, Big Shift, which is a movement around making generational change. And so it's always fun to be around pediatricians because you're pouring into these kids at a whole different level. What made you decide to become a pediatrician?
So the truth of the story for me is that I was 10 years old when I knew I wanted to be a pediatrician. If you ask my older brother, I was 4 years old. I was not in preschool. I knew I wanted to be a pediatrician. But I was 10 and I was that kid who loved math and science. I loved working with kids. I loved that idea of helping people, but through that spirit of math and science. I was watching different types of programs on TV in terms of surgical procedures. My mom wasn't certain, okay, well, it's on TV, it is learning, so I guess it's okay, because it kind of freaked her out to see the blood and things like that too. But I was like, no, this is fascinating. This is exciting. But then I would tell her, I want to do this science related program. I want to do this enrichment program. So when she saw that as a parent, she was very supportive of how do I help support you in doing this and in supporting this. I did pathway programs that allowed me to learn more about medicine, about pediatrics. I did my rotations, and it was actually on my OB/GYN rotation where I just helped a mother deliver her baby, but I forgot I was on OB. And I'm over assessing the baby, warming the baby under the warmer and doing all those things. And they said, Doc, you're supposed to be with the mom. You're on OB now. And I told the mom, I'm so sorry. I apologize. And she said, no, please make sure that my baby's okay. I'm fine. Check on my child. And they said, well, the mom told you to go over there. So I checked the baby. I gave her my assessment. And they said, I guess, welcome to Pediatrics to you. And so that's where I knew that's where I wanted to be, because there was just so much happiness and joy for me, but also seeing that longitudinal experience of a child coming in at 3 days old and then getting to see them grow through all the different development and the behaviors and all the things happening and going on with young people, but also supporting families. So even though I'm the pediatrician to the child, I also have to support the families, because if the parents aren't okay or the guardians aren't okay, the kids can't be okay as well too.
Well, I love that approach that you bring because, as a mom, I think that's huge. And that was what I was looking for in a pediatrician, was somebody that was also asking, like, how was I doing? Especially being a new mom and postpartum and figuring all those pieces out. It's a whole family unit, and you need to be able to approach it that way because it starts with the foundation. And I never really thought about it until you just said it that way, that you watched them birth to 18. I mean, you were there for all of those big milestones as well. And so what about that brings you professional joy, but what also brings you personal joy?
So professional joy is, I shared with you all that I'm also serve as a mentor, but also being in spaces where I can be a sponsor. So to see my mentees thriving, doing well, seeing their achievements and their successes, and they say, Dr. Smith, guess what happened? Guess what I did? And I love to see those things with them, because then I know, wow, you were successful. And like, why couldn't I have done it without you? I was like, no, you did all of it. You just allowed me to be part of the ride and part of the journey with you. So thank you for sharing it with me. So I really find that to be what brings me professional joy. Personal joy is, even today, right now, it's sunny outside. So I love seeing the sun shining. To be able to go outside in the sunshine and enjoy it, that brings me joy. Spending time with family and friends, being able to travel, and also sitting down and reading a book. So I love audiobooks, but I love actually sitting down and holding a book in my hands and just the feeling of a book and turning pages. I was that person growing up that I would get lost in my books almost to the point where my mother said, okay, I'm a school teacher and I want you to read, but I also need you to do your chores. So how do I balance the two of I want you to read, but you also have other things that you need to get done as well too?
I want to go back to watching and having the privilege to grow with kids. I think that's been one of my greatest joys is having people come to me as a kid and then become a parent and then become a grandparent and watching that generation. It's such a gift. It gives me chills down my spines thinking about it. When you get a chance to go back and look at treat some of your kids, how does that make you feel?
I consider it an honor and a privilege because they are entrusting me with the person that's most important to them in this world. It's also that spirit of knowing that if they had to choose between their life or their child's, they would say, save my child, make sure that my child is healthy, that they are well. And so I take that as a humble privilege and an honor to be in those spaces that people entrust me to provide good information and advice and education about how to best take care of their child. But it's also a collaborative effort that we're working together because I want parents to know that it's not just my decision or my choice, but it's also theirs. And we're working together to make these things happen. But for someone who I took care of and then they're bringing their child to me, it also is an honor because it's saying, okay, I did a pretty good job with you and you like the care that I provided for you. And now you want that for your child. And I think the hardest part for a lot of my young people is I see them up through 22. And when I have to gently nudge them out the door, some of them leave kicking and screaming because we know how they like their shots. We know who they want to give their shots. We know how they like their blood drawn. We know certain things that they prefer to have done. And so now they have to kind of grow. And we're like, but this is part of the process. You do have to grow. You do have to evolve. But you're going to do this. You're going to be great. We've already prepped you for this and you're going to be fantastic.
I want to circle back also for I mentioned when I was looking for a pediatrician, that was huge for me, but also having the representation and having somebody of color, being able to answer the questions that I was looking for. And also, just the safety aspect of Black women in childbirth. And when you're new mom and you hear all that, it's really scary. And so finding somebody that you trust and will advocate for you and hear you and provide that open space is huge. And so with your work in advocacy and health equity, what do you think our biggest disparities are in our community today?
I think some of our biggest disparities right now, from just a societal standpoint, there's a lot of things going on. Just being able to name and call things what they are, being able to say that there are disparities, being able to say health equity. In some spaces, we can't say those words, which I don't think that they're bad words. Talking with colleagues of mine, one of the things that we shared was that disparities means that we know that there's a difference. There's something that's happening differently for people. And people are okay with disparities, but then we say equity, which means let's make sure everyone has what it is that they specifically need. Then that's when there's a problem, a concern, or an issue. And I'm thinking that shouldn't be an issue or concern. And I think the other part too is that as a clinician, which a lot of us work together collaboratively to take care of patients. So it's not just doctors and nurses, but it's also everyone part of the healthcare team to take care of that patient. It's also that spirit that there are people who are not in healthcare that are dictating how do we do things. Do I think that there should be standards? Most definitely. Do I think there should be policies? Most definitely. But I think it should also go back to being a collaborative effort where we have people who are in the trenches taking care of the patients, who are also sitting at the table with the people who are able to make the policies and ensuring that collectively we're making appropriate change. If we just only have certain stakeholders in the room, the problem is that people are making decisions that impact a lot of people and not being aware of, wait a second, how's that going to hurt someone until they see the after effects? And sometimes with kids, we don't see the after effects till many, many years down the road. If I could talk about vaccines for just a brief moment, because that's been the hot topic for a lot of us, and especially as a pediatrician. For us, there's the HPV vaccine or Gardasil, and that's the vaccine that can help prevent genital warts, anal cancers, and cervical cancers. And as a general pediatrician, I don't see the impacts of that. But my colleagues in OBGYN or the obstetricians, gynecologists, they do see the impacts because they're not diagnosing as many women as having cervical cancer or anal cancers because of the fact that more people got the vaccine when they were younger as children. So I tell people, if you have healthy children, they grow up to be healthy adults. So why don't we put all of that thing on the front end in terms of all the things related to prevention, keeping them healthy, talking to them about their trajectory of their health, about how we can make it better. And I think last is access. How do we make sure that people have access to healthcare? First is making sure that people have adequate insurance, making sure that with their insurance, they can get the healthcare that they need. What I might need versus what you might need could be different things, but making sure that through our respective insurances, we can get whatever we need to allow us to have the most optimal healthcare as possible. But then we also have to think about, okay, I have my insurance, but do I have access to a doctor? Meaning, is there a doctor available that can take care of me? That includes primary care clinicians as well as any needed specialists. But wait, let's even go back further than that. I need to make sure I can get to see the person. So I have the insurance, I have the access to whoever the person is. But if I can't physically get there, then it doesn't matter that I have insurance or that there's someone I can go see. I really need to make sure that can I get there physically, whether it's through transportation systems, vouchers, Lyft, Ubers, whatever that looks like from that spirit and perspective. So really making sure that when we talk about access, it's not just looking at the insurance. We're looking at the clinicians, but all of the different aspects that allows for access to happen for patients and families.
That's a whole show. When they unpack that, I want to go back to, it's almost summertime. The kids are getting ready to get out of school. And how there are different opportunities for different people. So seeking to me as maybe a doctor who's giving people recommendations or connections of how they could care for their kids over the summer, whether they're Black, brown, white. What are some of your ideas of how to have a healthy summer with your children from both lenses?
I think with a healthy summer, it really depends on each family, because a healthy summer for one child is a healthy summer for that one child. Because some families do a lot of travel, but they have the privilege that they're able to afford to travel, whether that's locally or that's going to see family, is going out of the country, whatever that looks like. Some families also have the privilege that they can afford to do summer camps. Right now, since this is past Mother's Day, we have to think about the spirit of, okay, it's really too late at this point to try to find summer camps or summer programs and people are on wait lists. So really looking at those things really in November, December about those potential activities to look for young people. There are some things that have a nominal fee or some things that might be free, but people oftentimes are trying to look at what are things that I can have my child engaged in that will allow them to have a very productive summer that doesn't feel like school, but also that they're not losing all that information and knowledge that they've learned over that time. And then also looking at, as a family, what can we do together or with friends or with our neighbors? How can we interact and get outside? How can we be involved with different activities? I also remind families too, don't forget, it is summertime. All people need sunblock and sunscreen. So sun protection number of 30 or better, please. 30 or better, to make sure we protect all skin types. Some people might say, oh, well, certain skin types don't burn. All people can burn. So we want to protect all people when they're going out in the sun, but also making sure that they're safe in terms of pool safety, water safety, sun safety, staying very hydrated when people are outside playing and doing those different types of things. So it's really looking at what are some things that are out there and available. There's also a lot of great activities at local community centers, as well as the public library. I think that people forget that the public library has a host of resources and a host of different activities, not only in the summer, but also throughout the year. So those are also different things that people can look into in terms of various activities for their young people of all ages as well.
I'm glad you brought up water safety. I'm on the YMCA board, and that's one of our big programs is how do we help teach kids water safety. Some people call it swimming. We call it water safety. So I'm glad you brought that up. So give a shout out to my friends at the YMCA. Thank you for all the work you're doing to help kids not drown. It's amazing.
And also, if I can give a shout to the YMCA, because that was one of my first jobs growing up. So working at the YMCA, I also taught kids how to swim. So that was a great job. And also that's where I said that it was kind of medicine adjacent, because I was working with kids and also wanting to be a pediatrician. So the YMCA has wonderful programs, especially for high school students who are interested in working with kids as well.
I think one of the things that I underestimated as a mom was how quickly some of those activities fill up and where they should fall on my calendar to ensure that you get that. And so to the moms out there that feel that stress and pressure of, oh my gosh, summer needs to be so busy. I've got to do all these things. I've got to cart my kids from one thing to another. I think there's also just the beauty and the simplicity of it. And you mentioned it earlier about what brings you joy is being outside in this beautiful weather. Sometimes it's just as simple as that. And I think in this world, we overcomplicate everything, but especially in parenthood, and for good reasons, because we want better for our kids and we want to do the next best thing. But sometimes we make it really heavy and overcomplicated when it doesn't need to be that, because kids really just want that connection. They want that time and energy for you to just sit there face to face and hear them and see them. And so there's so much that can be done in that in between too, of yes, the socialization of getting them active and getting them out and about, but then also just taking those quiet moments when your kids are home more to be grateful and to see what they've learned and who are they growing to be and how can you really pour into that. And that speaks in parenthood specifically, but also mentorship, which you touched on earlier. And Dr. Edmond brings great guests to our show. I mean, instantly with your first answer, I'm like, yes, please feed me more. This is such a good conversation. But to your point of mentorship and all that you're pouring into that next generation, what piece of advice do you give to your mentees about how to stay grounded and how to balance all of the things that you carry?
I think staying grounded is people going back to what is their why. Why do you do what you do? Why did you decide to go into medicine? Because when you start to lose that sense of what your why is, then that's where people start to feel burned out. They start to feel resentful. They start to be more disengaged. It's not the best thing for that person, but also for patients and the people they're caring for. So I think it's really important for people to always go back to your why. And if you haven't asked yourself, what is your why? I always tell people, then ask yourself, what is your why? And are you doing what is part of your why? Now, we know that there's times in our work that we have to do some things that we may not care for, such as, okay, I have to write these long notes, but okay, I have to do that because that's part of patient care. We sometimes have to also, maybe we're seeing a lot of patients and it's a very busy, hectic day, but we have to always look at, but the why is, but I made sure that they were kids that were healthy. I made sure that they were well cared for and I provided them the best care possible that I could give to them. So a lot of mentees always tell them, please remember what is your why, but also remember what makes you who you are in terms of what brings you joy personally and professionally, because that why and that joy, I think, go hand in hand. Because if you know what your why is and you know what brings you joy, it also lets you know, okay, am I doing the things that I'm happy and joyful in doing? Are there things that people are bringing my way that I need to consider? Is this something that I want to do? How do I determine what does that look like for me? And if it doesn't match their why and their joy, then they might have to say, you know what, I respectfully decline, but please consider me for other opportunities in the future. Because you don't want to tell people I'm not interested at all, but you do want to let them know maybe this isn't the best time for me, but there will be time later in the future and letting people know that. I recall a time that a friend had wanted me to work in an organization with them. And I told them, well, I just don't have the capacity. But I said, if I remove 2 or 3 things off the list, I will definitely let you know and I will do that. And when 2 or 3 things came off the list, I kept to my word and I said, okay, 2 or 3 things came off the list. And they're like, fantastic, great. And so I think that's also the other part too, which is making sure that people know what are those things that they're interested in doing. And also, if you have mentors, talking to them saying, this opportunity came my way. What do you think about it? And the first thing I ask them is, does it go with your why? Does it bring you joy? Because if you can go back and say yes and yes, and that's something that you have to do, but now we have to work on, now what do we need to take off the plate so you have capacity to do this new activity? Because I think sometimes we say yes to so many things. Sometimes it's things we want to do. Sometimes it's things we have to do. And then sometimes there's things that somebody else can do it, but you can just be the supporter of those activities.
Thinking about May being not only Mother's Day, but it's also mental health awareness. And so we've got kids once again getting out of school. And from your lens as a pediatrician, how do I help guide my parents or my kids that I treat about their mental health? What are your recommendations? Maybe your top 3 things that you would do, if top 3 things you would recommend.
Okay. I think the biggest thing is as parents to check in. One thing I always tell young people, especially adolescents that I see in my office, is that your parent's job when you get older is to be annoying. Their job is to ask you a bunch of questions and you may feel irritated and bothered, but I tell them that's part of their parent handbook to make sure that you're doing okay. They're going to check in to ask if you're okay. So I always tell parents, make sure you check in to make sure that they're okay. When they're going behind closed doors in their room, knock on the door and say, I'm just checking on you to make sure that you're doing all right. Sometimes teens will say, I'm okay, I'm okay. And so I tell teens sometimes they may not have much to say. So have a word of mom, dad, parents, I'm doing fine and I'm okay. So that might be rainbows as an example. And then the word of I need you to come in. I need embracing. I need love. I need help. I need support. And that word might be monsters as an example. So that way they can say those one words to let people know, hey, I'm not doing so great. But also I tell people sometimes they may not be in the space to tell you those words about how they're feeling. So maybe having a certain signal that if the parent sees that signal, they know, wait a second, I need some help. I need some support. I know a lot of times we use the phrase calling something out, but I more so like to use the phrase calling something in. Because if I'm calling you in, I'm pulling you in to embrace you, to help you, to support you, and also to nurture you through whatever you have going on. I think as we think about parents too, we're telling them check in with kids, but also parents need to check in with parents. So sometimes the kid's not going to say, oh, mom, dad, how are you feeling today? How are you doing? So sometimes as a parent, you might have to check into yourself or check in with your other friends. So if you're in parent groups with other moms, other dads, other parents, to check in with them and say, hey, how are you doing? Because someone may not have asked you, how are you doing today? But also ask it sincerely and genuinely, because maybe they may tell you, I'm not doing so great. Okay, let's pause a second. Let's talk a little bit more about this. I know sometimes in my office, one of the first things I do for newborn parents is I will say, what brings you joy? You all know that's my favorite word. What brings you joy? Because I tell parents before you had the title of mom and dad, you were also an individual person. Now, everything's going to be about this newborn, but I need you to make sure that you're taking time to yourself, mommy time to yourself, daddy time to yourself. That's selfishly only going to benefit you in the immediate sense, but in the long run, your whole family and also your children. Mommy and daddy time together, that is date night. Or daddy time together, mommy time together, that's date night. You need to have that. The whole family together is family time. So really making sure that people understand that distinction from that spirit and that perspective. But also as we check in with mental health, if you see any types of changes in the behavior of your young person, if you see that, they're normally the young person who was hanging with this friend and now their friend group has changed, or they don't want to do those things that they find enjoyable, or there's a lot of things that they feel very anxious about, or there's just something that just doesn't seem the same about your child. Check in, ask questions, find out what's happening, find out what's going on. If you're uncertain, make an appointment to see their clinician to have that conversation together, because sometimes young people may not tell their parent or their guardian directly, but they might, if they have that strong relationship with their clinician, they may tell them, this is how I'm feeling, this is what's going on and happening with me. Because I tell people it's a collective effort. We all have to work together to help keep these young people healthy.
I think too, we talk a lot about breaking generational cycles here at Small Changes, and how do you determine what are you going to keep and pass on to the next generation, and what are you going to end? And mental health is a big one where we're seeing a huge generational shift of parents asking those questions, pausing to check in. And I think though, while the conversation is starting, from a parent perspective, there is still this bit of shame or fear around admitting that maybe your child does need some extra help or may need additional resources, or it's outside of your bandwidth, and that's okay. What advice would you give for parents that are holding the space for their children having mental health issues? What advice would you give to them?
The first thing that I tell parents, there is no shame. You did nothing wrong. With children, you gave birth to them, whether they grew from your body or from your heart, and they didn't come with an instructions manual. And if you have one child, you have one child. If you have 3 kids, there are 3 different instruction manuals that you need for your children. So there is no shame. I think it's important to make sure that we validate how parents are feeling, because sometimes they feel like I did something wrong or I didn't do the right things. And it's not that. Some parents will say, well, I gave them everything they wanted. It's not about the things. It's not about the items. It's really looking at the person and helping that person and supporting them through it. I think the biggest thing is the first, acknowledging that there's something going on with their young person. And after acknowledging that there's something going on, now what do we need to do to support them and get them the help that they need? Sometimes for young people, they just want their parent to just listen. I was that kid. It's like, Mom, I'm not looking for you to fix it. I already know what the fix is, but I just need to get it out there. So I just need you to be a sounding board. And so she learned, am I a sounding board, or do you need me to help fix it? And so that was always helpful. So then I would just always say, okay, sounding board, okay, fix it. So therefore, it's easier for her to know, how do I need to listen for what you're about to share with me or what you're about to tell me? I think the other thing also is for parents, believe your young people when they're telling you things. Don't make assumptions about what you think they're trying to tell you. Please believe them when they're telling you how they're feeling. Please believe them. Because what often happens for a lot of young people is that they're trying to tell their parents, I'm in distress, or they don't know how to say I'm in distress, or I need help and I need support. So sometimes they might have acting out behaviors because they're trying to get someone's attention to let them know I need help and support. Something that parents often have thought in my office, and I don't want to say often, but a few parents have thought this, was that when we ask questions in terms of just checking in for risk factors about suicidal ideations or risk factors for suicide, that we're putting those ideas in their minds. The actual fact of the matter is we're actually not putting ideas into their minds. We're actually sometimes the first people to ask those questions, and they feel the relief of, someone asked me, I can now talk about it because now they've opened the door that I can have that conversation. So really, we're asking those questions for the spirit of making sure that we're checking in and we're finding out how they're feeling and how they're doing. And I also share with people, my integrity is to keep kids healthy. I would never want to hurt or harm a child or cause a child to want to hurt or harm themselves or support or promote anything of that sort as well too. And I tell parents, I want your child to get the best care possible. If it's not with me, that's okay. If it's with someone else, that's okay too. But the biggest thing is that your child receives excellent health care.
Dr. Tyler, I mentioned that we met because of Dr. Marion, and we've heard you talk about mentors and sponsors and mentees in community. I want to, first of all, say thank you for the work you're doing. Okay. Being on I'm going to call it the other side in the wellness world, typically we have a little bit of an easier road on some levels because people have gone to somebody like you and are like, okay, I don't have heart disease, I don't have diabetes, I'm not suicidal, yet something's not quite right. And they kind of drop in our lap of some sort, and we get a chance to guide them, which we take very seriously, which as you do as well. I love that you said my integrity is my curiosity is how do I best help your children? And so we met because this Women in Medicine group that started over 20 years ago, just trying to support physicians because there is a lot of stress being a person that kind of the buck stops here, and you want to make sure you're always giving that advice that is great guidance. Tell me what it means to you to be surrounded by other women in medicine, encouraging them, and then also what have you noticed involved in the group of Women in Medicine in Kansas City?
What I think has been helpful is just to providing another space to be amongst other people that have had similar lived experiences and similar journeys as myself. Being a woman in medicine, sometimes we walk into spaces and people don't think that you're the person in charge. They think that you're everything but the doctor. Sometimes I've been in a room for 30 minutes and someone will say, well, when's the doctor coming in? And I'm like, I am the doctor. And they're like, but you don't have a white coat. I was like, it carries germs and it scares kids. So that's what I prefer to not wear. I say I can put one on if that helps you. So that way you know that I am the doctor, but I'm still going to be the doctor, even if I put on the coat or not. But I think being in this space was helpful is knowing that you're not the only person that has had some of these challenging experiences, but also knowing that you're sharing some of those wins as well too. I am always a person of women supporting women. So if one woman has won, then I feel like, yes, we all won. And even though that's theirs, but it lets me know I can win too. And I'm hoping that people will be supportive of me when I had that winning moment. So therefore, that's that other spirit of being able to be supportive of other people and what they're doing. Or, wait a second, you figured out how to do this. I'm really interested in that. Tell me more. Let's lean into this. How do we make something like that happen? Because I also feel like that too, that's part of that sponsorship piece, which is the mentor tells you how to do something, but the sponsor allows the opportunity to use those skills that the mentor gave you. And so when you're in these spaces of that sponsorship, that's where you get to have these opportunities that you would say, wow, I've always wanted to do that, but I never knew that I would think about having that. Marion allowed that moment for me to come into that space as a sponsor, to be in that space with women in medicine. And then now to be with you as a sponsor. This is my first time doing a podcast, and I was very excited about that. You know, my family is like, what are you going to do? What's that look like? I said, I don't know, but we'll see together. But I share that from the spirit of it's those opportunities that we allow for other women to have, those spaces that we allow to have a moment to say, you know what, it was a really rough day. There was one time where I was about to drive past and I said, you know what, let me stop through. I'm really late, but let me stop through because there's going to be a nugget of information that I can get from this space, whether it's for myself or that I can give and impart to other people. And that's what I think has been great about the group is that we can all come together and we can share some of those experiences that we're having that's going on, but also how to support each other in our communities as well too.
You know, it's so fun to build community. I'm so curious. And I think one thing I love about my upbringing, I come from a small town, moved a lot. So I like change, probably a little bit too much. The second thing is I grew up in a small town that was very diverse. And so I'm reflecting. I've been doing a lot of reflection, turning 60, thinking about the things that made me who I am today. And I want to say that women in medicine has made me a better partner, a better doctor, a better community citizen. And I absolutely love how you bring such an infectious energy to any conversation, even today. So I'm really glad you joined us today, and I'm really glad you're spending time with the women in medicine.
I want to give you a couple of kudos. One, I wouldn't have known this was your first podcast. You've done a great job. And second, thank you for the work that you're doing. Truthfully, I think that oftentimes in the world that we're in the information that's being thrown at us left and right, it's hard to sometimes find the good. And I think to our listeners out there, if you're wondering, who can I trust? What resources do I have? I am telling you, I'm surprised every day about the resources that we have specifically here in Kansas City, but really there are good doctors all over the world, like Dr. Tyler and like Dr. Robin, who care at a deeper level, who want to see you thrive, who want to know who you are outside of just the symptoms that they're working on with you, and they see you as a whole person. And so if you don't have somebody like that in your life, I encourage you to stand up for yourself and to have that patient advocacy and find those trusted resources because they are out there. And the people that go into medicine, and like you said, from the mentor perspective, not losing touch of that why. Those are the ones you want to surround yourself with because they are doing it because it's their sole purpose. And I truly believe that being a pediatrician is your sole purpose, and a mentor too, and a sponsor. And there's so much good that you're pouring out into our community. So I'm grateful that we've got to have the conversation today and for the work that you're doing. And for our listeners, thank you for joining us again on another great episode of Small Changes, Big Shifts. We are blessed to have the best people, and luckily they're in Kansas City, so they get to join us in person as well. So we look forward to talking to you more next week, and until then, we're sending you all big heart-to-heart hugs.